Good morning, students. Today's topic is Alzheimer's disease. So, Alzheimer's disease, it is also comes under the central nervous system disorder. So, what is Alzheimer's disease? Alzheimer's disease, it is a degenerative disorder, degenerative brain disorder, and the cause which will be unknown. Degenerative disorder, it means the patient who are having the problem of characterized by progressive deterioration and loss of function in the organ or tissues, which will be results in brain disorder, which is the most common form of, and it is also a most common form of dementia that usually starts in late middle age or in old age, results in progressive memory loss. Means in this Alzheimer's disease, the patient is having the problem of progressively memory loss, and the patient is also having the problem of impaired thinking and disorientation and changes in personality and mood. There is degeneration of brain neurons, especially in the cerebral cortex, and presence of neurofibrillary tangles and plaques containing beta amyloid cells. Means there will be degeneration of brain neurons. Means this degeneration which will be occur in cerebral cortex, and presence of which will be creating plaque formation, and plaque which will be containing beta amyloid cells. Then what is the meaning of this Alzheimer's disease? So the meaning of Alzheimer's disease, that is it is a chronic irreversible disease that affect the cell of the brain. Means it is chronic disorder, and it will be also irreversible disorder. Basically it will be affecting the cells of the brain, and it will be causes impairment of intellectual functioning. Means slowly it will be creating the impairment in the intellectual function, so that the patient is having the problem of orientation problem, or the patient is having the problem of memory loss. Then Alzheimer's disease is a brain disorder. Means it comes under the brain disorder which gradually destroy the ability to reason. Means because of this Alzheimer's disease, the it will be destroying the ability to reason, remember, imagine, and learn. Then this is a picture of the comparison of normal aged brain and Alzheimer's patient brain. So differential characteristics are pointed out. So in this we will see that severely enlarged ventricles in the brain. Means there will be some plaque formation which will be occurring in the brain. So the patient is having the problem of impairment in the function of the brain. Then what are the incidence rate of this Alzheimer's disease? About 3% of men and women aged 65 to 74 have Alzheimer's disease, and nearly half of those age 85 and older may have the diseases. Means in 3% of men, and basically the age group that will be affected of this Alzheimer's disease, that is 65 to 74 have Alzheimer's disease. Then nearly half of those age, that will be 85 or older, may have this disease. About 3,60,000 new cases of Alzheimer's are diagnosed each year. Means the incidence rate which will be very high, in that the 3,60,000 new cases Alzheimer's disease which will be diagnosed each year in worldwide. Then next one is the causes. In the causes of Alzheimer's disease, the causes that will be not known. Means the exact cause that will be not known. Some risk factor that will be creating this Alzheimer's disease. However, several factors are thought to be implicated in this disease. Means we will think that some factors which will be implicated in this Alzheimer's disease. So what are these factors? So first is the neurochemical factors, means the neurochemical factors which will be affecting the brain, and because of this the person which will be developing the chances of this Alzheimer's disease. So the first neurochemical factor, that is acetylcholine. Acetylcholine, it is a neurotransmitter which is a chemical released by nerve cells or neurons. So acetylcholine causes muscles to contract or activated pain response and regulated endocrine and REM sleep functions. So when the person is having the problem of deficiency of this acetylcholine, so in that condition the person which will be developing the chance of this myasthenia gravis, that is also a type of central nervous system disorder, or it will be weaken the muscles, and because of this also the person may be developing the chance of this Alzheimer's disease. The next is somatostatin. Somatostatin, it is a hormone which will be produced by many tissue in the body, then principally in the neurons or and digestive system. It regulate a wide variety of physiological function and inhibit the secretion of the other hormones. So when it will be creating any defect, or when it will be increase or decrease, in that time also the person may be developing the chance of this Alzheimer's disease. The next is the substance P. Substance P, it is a neuropeptide, so that act as a mediator of pain transmission, means in the brain it act as a mediator for pain transmission in the central nervous system and during neurogenic inflammatory in the periphery, means when the substance P which will be affected and any inflammation which will be occur in the brain, so in that condition also the patient is also having the problem of this Alzheimer's disease. The uh, next is the norepinephrine. Norepinephrine, it is also um, neurotransmitter. So in that when any disturbances which will be occurring this, so the patient is also having the problem of this Alzheimer's disease. Then next is an environmental factor which will be also causing or it is a risk factor of this Alzheimer's disease, that will be cigarette smoking which will be also affecting the function of the brain. Then certain infection which will be infected to the brain, so because of this viral infection or bacterial infection, it will be creating this Alzheimer's disease. Because of this infection, it will be creating the dysfunction in the brain. Then next is metal, industrial or other toxins, means the person who are working in the industrial areas, and they will inhale any toxic substance which will be affecting to the brain. In that condition also the person is developing the chance of this Alzheimer's disease, because we have already discussed about the causes which will be unknown, so there will be some risk factor. Then next is the use of cholesterol lowering drugs such as a statin. If the person who are taking the cholesterol lowering drugs, usually the person who are having heart diseases, in that condition they will take this cholesterol lowering drugs. It will be also affecting the function of the brain. Then next is genetic and immunological factor. Genetic or immunological factor means if the person is having this disorder in their family, so it will be also affecting the other family members. So why it will be occur in the patient in genetic or immunological factor? In this, oxidized LDL receptor 1 and angiotensin 1 converting enzyme are tied to the way of brain cells which will be bind to uh, apolipoprotein 4, and it will be reduces, means this APO4, it will be reduces the buildup of harmful protein known as plaques in the brain or respectively. So means it will be creating the buildup of the harmful protein. So because of this it will be reduces the buildup of harmful protein. So because of this the plaque formation in the brain respectively, so that the person is having the problem of this Alzheimer's disease. Then what are the risk factor? If the person is having all, means if the person is already having the problem of Down syndrome, then family history, or if the person is having the problem of chronic high blood pressure, or if the patient is having any head injuries, then gender and smoking and drinking. So these are the risk factors which will be developing the, means which will be further developing the chances of this Alzheimer's disease. Then next is the pathophysiology. Pathophysiology of this Alzheimer's disease. Then say due to etiological factor or the risk factor, because of some risk factor, it may be environmental factor or genetic factor or neurotransmitter factor. So because of this, the changes occur in the protein of the nerve cell of the cerebral cortex. Means in the cerebral cortex, there will be some protein of the nerve cells. So in this protein, some changes which will be occur. So when the changes which will be occur in the protein of the nerve cell of cerebral cortex, it will be creating the accumulation of neurofibrillary tangles, and it will be form the plaques. Means this means because of this protein of nerve cells which will be changed. So because of this, the accumulation which will be occur, and when the accumulation which will be occurring neurofibrillary tangles and plaques, it will be creating the granulovascular degeneration. Means the vessels which will be degenerative, and because of this loss of cholinergic nerve cells, the cholinergic nerve cells which will be lost. So because of this lost cholinergic nerve cells, it will be leads to loss of memory and function and cognition. Means loss of memory, function and cognition, these are the sign and symptoms of the Alzheimer's disease. Means basically it will be leads to Alzheimer's disease. So these all are about the pathophysiology of Alzheimer's disease. Then this is the image, or this is microscopy image of neurofibrillary tangle that will be confirmed by hyperphosphoryl related tau protein. Means in the brain, this type of tangles which will be formed in the patient who are having the problem of this Alzheimer's disease. Then this is the picture, or this is the differentiation between the normal neurons or Alzheimer's patient neurons. So you are seeing that in normal patient's neuron, that will be normal, but in Alzheimer's patient, the neurofibrillary tangles, this about the neurofibrillary tangles, and in neurofibrillary tangles, or in between the neurons, there will be amyloid plaques which will be formed in the brain. So because of this, the patient's brain which will be not able to function properly, and it will be affecting the function of the brain, the function of brain like memory, orientation. So it will be affected. Then this is the enzymes. Enzymes act on the amyloid precursor protein and cut it into fragments. The beta amyloid fragment is crucial in the formation of senile plaque in Alzheimer's disease. So here in the picture, in last picture, we will see that the beta amyloid plaques which will be combined, and when the plaque formation which will be occur, so it will be creating the function in the brain, it will be affecting the function of the cell membrane. So because of this, the person which will be developing the chance of this Alzheimer's disease. Then in this we will see that in Alzheimer's disease, changes in tau protein, which will be lead to disintegration of microtubules in the brain cells. So the tangles, clumps of tau protein, means the normal chain which will be forming the tangles, or which will be formed clumps of tau protein. So because of this clumps, it will be creating the function, it will be affecting the function of the brain. Then what are the signs which will be present in the Alzheimer's disease patient. So there will be 10 warning sign of Alzheimer's disease. So the first sign of Alzheimer's disease, that will be memory loss. The patient is complaining that the patient is having the problem of memory loss. Patient is complaining that the patient is not having any memory, means the previous memory which will be lost from the patient. Then difficulty to performing familiar task, means the familiar task the patient is not able to perform. Means the regular task which will be performed by patient daily, that task which will be difficult for the patient. Then problems which language, means the person who are having the problem of this Alzheimer's disease, the person is not able to talk properly, or the problem with language, means the another person which will be not able to not able that the patient is patient what trying to tell the another person. Then next is the disorientation to time and place, means the patient is having the problem of orientation problem, means the patient is not oriented with the time, place or person. Then poor or decreased judgment, the judgment which will be also lost. Then the problems with abstract thinking, means these are the functions which will be present in the which will be present in the patient's brain, means normal brain, that will be function these all things. Then misplacing things, means the person is not remember the things which will be, sorry, where it will be kept. So misplacing things. Then changes in mood or behavior, means sudden the person's mood which will be changed. Sometimes the patient is very happy, sometimes the patient is crying, sometimes the patient is very, yes, depressed. Then changes in personality, the patient is having also personality changes. Then loss of initiativeness. So these all are the 10 warning signs which will be present in Alzheimer's disease patient. So we have to see in these type of patient, and we have to observe this 10 sign in the patient. Then what are the symptoms? So the symptoms, that is confusion. Patient is confused, means the all time patient is showing confusion about time, about place, about person, about things. Then disturbances in short term memory, it will be also affecting the disturbances in short term memory. Then problems with attention, means the patient is not fully attendant, matlab, the patient is not not properly attend. And spatial orientation, then the person is also having personality changes, language difficulties and unexplained mood swing, means we will not explain about their mood swing. Suddenly the patient's mood or the behavior which will be changed. Then what are the diagnostic tests we have to perform in the patient who are having this Alzheimer's disease? So the first is psychiatric assessment, because in that Alzheimer's disease, the patient is also having the problem of memory loss, cognitive function loss, then judgment, orientation. So in that time we have to do the psychiatric assessment. Then mental status examination and neuropsychological assessment. So in this mental status examination and neuropsychological assessment, we will find out that what all abnormality which will be present in the patient, and what all functions which will be disabled in the patient's brain. The next is the laboratory test. Laboratory test in which we have to do the blood test. In blood test we will see the acetylcholine, means um, uh, uh, the thing which will be affecting the function of the brain. Then we have to do the imagine test. Why we have to perform this imagine test? Because in with the help of this imagine test, we will see that the patient's brain or the neurons which will be affected or not. So in that we will we will perform computerized tomography scanning test, then MRI, PET and SPECT. So these are the imagine test, and with the help of this imagine test, we will see what all changes which will be present in the patient who are having the problem of Alzheimer's disease. Then next is the CSF examination. Why we have to perform this cerebrospinal fluid examination? Because the risk factor of this disorder, that is also infection. So if the person is having any infection, so with the help of this cerebrospinal fluid examination, we will see the any infection which will be present in the brain. Then electroencephalogram. So with the help of this electroencephalogram, we will see the electrical impulses which will be generated in the brain, that will be function properly or not. Then next we have to do the electromyogram. So these are the diagnostic tests which will be performed in the patient who are having the problem of this Alzheimer's disease. The next is the PET scan, positron emission tomographic test. In this we will see that in this imagine we will see that the brain of a person with Alzheimer's disease showing a loss of function in a temporal lobe. Then what are the pharmacological interventions? So we have to provide acetylcholinesterase inhibitors. So why we have to give this acetylcholinesterase inhibitors? Because it will prevent the breakdown of acetylcholine, a chemical messenger important for learning and memory. Means it will be helps to prevent the breakdown of acetylcholine. So when the breakdown which will be reduces breakdown of acetylcholine which will be reduces, so in that time a chemical messenger which will be important for learning and memory. So the drug name that will donepezil or Exelon or galantamine. Then next is N-methylase aspartate receptor antagonist. So in this the example that will be memantine, that is block the NMDA receptor and inhibit their overstimulation by glutamate. Glutamate, that is also one type of neurotransmitter. So we have to give this NMDA receptor, and the drug name that will be memantine. And then we have to also give antidepressant drugs because the patient is having the problem of depression, mood swings, then the patient is having psychiatric problems, so we have to give antipsychotic drugs. Then the patient is having the problem of, sometimes the patient is having the problem of convulsion, so we have to give the anticonvulsant drugs. Then what is psychological intervention we have to perform in the patient who are having the problem of this Alzheimer's disease? So in that uh, we have to do first behavioral approach. In behavioral approach means we have to see the patient's behavior, and according to the patient's behavior we have to orientate the patient behavior. Then next is the emotional oriented approach. In emotional oriented approach, the first is the reminiscence therapy. Reminiscence therapy means reminiscence therapy, it is a one type of therapy which is used to counsel and support older people. Means we have to counsel the patient and support the older patient, and it is an intervention technique with brain injured patient and those who appear to have Alzheimer's or any other form of cognitive disorder. So in that time we will use this reminiscence therapy. Then next is the validation therapy. Validation therapy, it is also a method of communicating and being with disoriented very old people. Means the age group of this Alzheimer's disease, that will be 65 to 74 or 85 or more than 85 years. So in validation, it is a method of communicating and being with disoriented very old people. It is a practical way of working that helps to reduce the stress, which will be enhancing the dignity, and it will be increase the happiness of the patient. Then next is the supportive psychotherapy. Supportive psychotherapy means we have to give some support to the patient, and we will give the psychological therapy for the patient or psychological support to the patient, so that the patient which will be having the problem of swings or behavioral changes, so it will be reduces. Then next is the sensory integration. Sensory integration means it is a term that is used to describe process in the brain that allow us to take information we receive from our five senses. That means certain sounds or sights or smell, texture, and taste can create a feelings of sensory overload. Then next is the stimulated presence therapy. Stimulated presence therapy is an emotion oriented non pharmacological intervention for people who are having the problem of dementia, delirium, or Alzheimer's disease. It is based in psychological attachment theory and is normally carried out playing a recording with voices of the closest relatives of the patient. So it will be helpful to reduces the patient fear or anxiety, and the patient which will be feeling happy. Then next is the cognition oriented approach. This cognition oriented approach or method means it is a method that emphasizing the development of thinking skill, because in that time the patient is having the problem of reduces the thinking judgment. So in this the development of thinking skill also referred to as thinking operations, the thinking skill that should be taught directly are interpreting, comparing, criticizing, classifying, or analyzing, or summarizing and creating. The next is the stimulation oriented approach. So this stimulation oriented approach, it is a treatment. It includes art, music, and pet therapies, exercises, and any other kind of recreational activities for the patient. So stimulation has modest support for improving the patient's behavior, mood, and to lesser the extent function. So these all are about the psychological intervention which will be given to the patient who are having the problem of this Alzheimer's diseases. Then next is caregiving. So since Alzheimer's has no cure, means this is a progressive degenerative disorder. So this Alzheimer's disease that has no cure, and it gradually renders people incapable of tendering for their own needs. Caregiving essentially is the treatment and must be carefully managed over the course of the disease. So in that we have to provide the care to the patient who are having the problem of Alzheimer's disease. So in that we have to provide the proper care. We have to maintaining the hygiene of the patient. We have to orientate the patient. Because the patient behavioral changes, and the patient which will be not able to maintain their hygiene, so we have to provide the care to the patient. Then, what about the prognosis? The prognosis of the disease are difficult to uh, diagnose. A definitive diagnosis is usually made once cognitive impairment compromises daily living activities. Means we will not confirm the diagnosis. Means the diagnosis means it will be difficult to diagnose or confirm the diagnosis of this Alzheimer's disease. So a definitive diagnosis is usually made once the cognitive impairment which will be compromised in daily living activities. Means when we will see that the patient is having the problem of cognitive impairment which will be occur in the patient, and the patient is not able to doing their daily living activity, although the person may still be living independently. He will progress from mild cognitive problems such as memory loss through increasing stage of cognitive and non-cognitive disturbances, eliminating any possibility of independent living. Then what about the life expectancy of this Alzheimer's disease patient? So in this, of the population with the disease is reduced, the mean life expectancy following diagnosis is approximately 7 years. Fewer than 3% of patients live more than 14 years. Disease features significantly associated with reduced survival are an increased severity of cognitive impairment, which will be decreased functional level, history of falls and disturbances in the neurological examination. So then other coincidence diseases such as the patient is having the problem of heart problems, diabetes, or history of alcohol abuse are also related with shortened survival. Means if the patient is having these all disorder, or if the patient is having alcohol abuse, so it will be also reduces or shorten the rate of the survival in this disease. While the earlier the age at onset, the higher the total survival year. Life expectancy is particularly reduced when compared to the healthy population among those who are younger. Men have less favorable survival prognosis than women. The disease is the underlying cause of death in 70% of all cases. Pneumonia and dehydration are the most frequent immediate cause of death in Alzheimer's disease, while cancer is a less frequent cause of death than in general population. So these all are about the Alzheimer's disease. So thank you, students.